Hello everyone, and welcome back. In today's class, we're going to be discussing the cubital fossa. And the cubital fossa is a triangular depression that is located on the anterior aspect of the elbow. In one of our classes, we said that the elbow joint is that area that connects forearm to the arm. So essentially, the cubital fossa is located on the anterior aspects of this joint. So, and this fossa serves as a passageway for structures to pass from the forearm to the arm. We're going to be using this outline. We have boundaries, contents, relations, and clinical significance. So let's go to boundaries. The cubital fossa is bounded superiorly, laterally, and medially. So the cubital fossa is bounded superiorly, laterally, and medially. So if you recall, superiorly is towards the head, right? And we said the medial border is closer to the midline, the lateral is further away from the midline. So, and it also has a floor and a roof. So if this is a diagram illustrating the arm, say it has a superior border, a medial border, and a lateral border. So if this is the diagram of the forearm, we're saying that it is bounded superiorly by an imaginary line drawn from the medial epicondyle to the lateral epicondyle. If you recall from the histology of the humerus, that a medial epicondyle and a lateral epicondyle. So an imaginary line drawn from this medial epicondyle to the lateral epicondyle is what forms the superior border of the cubital fossa. So let's go to the lateral border of the cubital fossa. And the lateral border of the cubital fossa is formed by the medial border of the brachioradialis muscle. So if this is the brachioradialis muscle, if this muscle is the brachioradialis muscle, so this cubital fossa, that triangular depression, is formed by the medial border of the brachioradialis muscle. So having said that, let's move straight to the medial border. So I'm saying that the medial border of the cubital fossa is formed by the lateral border of the pruritor teres muscle. So if this is the pruritor teres muscle, this muscle here is the pruritor teres, we are saying that lateral border forms the medial border of the cubital fossa. So having said that, let's go to the roof and the floor. So the cubital fossa is formed, the roof is formed by the bicipital aponeurosis, by the fascia, by the subcutaneous parts, and skin. And the floor of the cubital fossa is formed by the brachialis proximally and the supinator distally. So having said that, let's move straight to the contents of the cubital fossa. Now, if you recall from the definition, we said that the cubital fossa serves as a passageway for structures to pass. So essentially, we have three main structures that pass through the cubital fossa, and they are the tendon of the biceps brachii. This is the biceps brachii. It is a tendon, and tendon connects muscles to bones. So the tendon of the biceps brachii, then the brachial artery. This is the brachial artery, labeled red. The brachial artery. This is the brachial artery. For reference purposes, it's the brachial artery, and the median nerve. The median nerve. This is the median nerve. It's the median nerve. So if you now want to move from medial to lateral, you can see the contents are the median nerve, the brachial artery, and the tendon of biceps brachii. So it is this brachial artery that will still bifurcate to form the ulnar artery and the radial artery. Lastly, we're going to be discussing the clinical significance of the cubital fossa. Why is it important to study the cubital fossa? And the number one reason is that it's a site for venipuncture. Now, venipuncture is a clinical procedure where the veins are being punctured to get blood or to give you IV medications. And this is very important because the median cubital vein is located in the cubital fossa. Now, another clinical significance is that blood pressure measurements is being carried out at the cubital fossa due to the presence of the brachial artery. Now, once again, the brachial artery can also be palpated at that junction, which is the cubital fossa. Now, lastly, we have the supracondylar fracture, and a fracture to the supracondylar area of the humerus or a distal part of the humerus can cause damage to the brachial artery and the median nerve. So once again, the cubital fossa is a very important aspect of the body. It's located on the anterior aspect of the elbow. It is a triangular depression that serves as a passageway for structures from the forearm to the arm. So if you have any questions, kindly drop them in the comment section. See you next class. Thank you.